So scientists are currently studying the new variant of concern, Omicron. The variant has been detected in 11 other countries. Based on existing data, scientists expect the current vaccines to remain protective against hospitalisation caused by Omicron. The emergence of the new COVID-19 variants over the last several months have raised questions about when the pandemic will end and the vaccination, how effective will that be against this new variant of interest. We're joined now by Professor Salim Abdool Karim, Director of CAPRISA and Vice President of Outreach and Engagement at the International Science Council. A very good evening to you, Prof. Always a pleasure to talk to you. So the big question, the Health Minister, the President and scientists saying don't panic, but the mutations identified in Omicron provide some theoretical concerns, especially around whether it could be slightly more transmissible than the Delta variant, and will it have reduced sensitivity to antibody activity? How do you answer this? How do we rationalize all of this information?
Very good evening, Mr. Piso, and good evening to all of the viewers. I think right at the beginning, we need to go back to September this year, where we were looking at the state of the pandemic, and we said there's a very high likelihood that we'll see a new variant and a high likelihood that we'll see a fourth wave. And we basically estimated, based on the past 3 waves, we'll see that in December. So this is not unexpected. We've been waiting for this. We anticipated this, and it was just a matter of when or what it was going to look like. So the government invested heavily in developing the genomic infrastructure in order to identify a variant as early as possible, because the earlier you identify it, the more effective you can act against the virus. And so we did. The team that is led by Professor De Oliveira and the NICD were able to identify this virus very early, and they were able to share it with the world. So we've been expecting this, we've been planning for it, and we've been preparing for that. So it is not unexpected. We are not caught with our pants down. We are ready. Now, the next question is, we were not clear what this next variant would look like, but we anticipated that it would have some measure of immune escape, because if it doesn't, it would be very hard to spread in a population that's been vaccinated to a significant extent. So this is not unusual. We've been waiting for this. Now, this particular variant is concerning. Not very concerning, but quite concerning, because it has mutations that overlap with the other 4 variants of concern. It has deletions and mutations overlapping with the alpha variant, with the beta variant, gamma, and delta. So if you look at some of the mutations it has in relation to the Delta variant, you get some idea about what's going on in this virus, because we don't know the behavior of this virus. We know nothing. We haven't known about this virus for a week. So we have to extrapolate it based on the mutations.
So, Prof, I'm going to ask that we bring up the questions from our viewers, and we can carry on along this train of thought maybe as you answer some of the questions. We're going to take it 3 questions at a time. So this one is from the Real 212, saying that with the current vaccines in our country, can they protect us against a new variant, Omicron? How do we ensure our safety in our country with this new variant amongst us? So can we get protection, especially with the current vaccines, and how do we ensure safety in our country generally, I think, amongst us? And the next one, It's from TD. Why is the world discriminating against South Africa just because of this variant that was found in South Africa? Good question, TD. And Toby C. Nene saying, why was Wave 4, which was expected to hit mid-October, November, postponed after the announcement of Election Day? Political leaders held mass gatherings, political campaigns, where COVID-19 regulations were not observed. Was Omicron planned? So, Prof, an interesting one. It's being spoken about very loosely, but I think it's worth starting then we can work our way backwards on why we've been discriminated and just also the vaccines that we currently have in the country. How can Omicron, react or interact with that?
So, that is the key question, and that's what's the source of much of the international panic that we are seeing, which is, will their vaccines protect against this particular variant? So let me explain this because it's not a straightforward issue. We don't know the answer to that question until the studies are completed, and those will take a few weeks. But in the meantime, we can extrapolate based on the mutations we are seeing to get some idea about what's likely to happen. So let me explain what is likely to happen, just accept that I don't know the answer for sure. If we knew the answer, we'd have no uncertainty. So we are uncertain, but let's look at what is likely to be the case. So when we look at the mutations in this new variant, it has mutations that confer a certain level of immune escape from different parts of our immune system, but mostly from the antibodies that we generate from natural infection and from vaccine. So we're expecting that there will be some level of immune escape. It will, in all likelihood, be partial, not full, and in all likelihood, the escape will be more from natural antibodies than from vaccine antibodies. So that's what we are expecting. That means that individuals who've been infected naturally in the past, they've had COVID, and they haven't taken a vaccine, they are at probably pretty high risk of getting reinfected. So they should go and get a vaccine quite quickly, because a vaccine together with natural immunity is a very strong protection against pretty much all the variants. Second issue is, besides those with natural infections, those who've been vaccinated, our vaccines generate two kinds of immunity, antibodies and T cells. Now, if there is some escape from the antibodies, which is what we think is going to happen, then we will start seeing cases of mild infection in people who are vaccinated. But as far as severe disease and hospitalization is concerned, there we're pretty confident, based on what we've seen in the other variants of concern and the way in which T cells protect us, that the vaccines, the Johnson & Johnson vaccine and the Pfizer vaccine, should have very high efficacy and maintain that efficacy for severe disease and hospitalization. So we are not likely to see a lot of severe cases and a lot of vaccinated people being hospitalized. But unvaccinated people, they are going to run that risk. In fact, this variant is a wake-up call to all those who've been somewhat, hesitant about, or just they've been too busy to get their vaccines. Go and get your vaccine. You want to be at least 7 to 14 days post first dose when this virus comes around. So go quickly and get your vaccine. Now, we don't know for sure what is the level of protection that we will see for mild disease. What we have seen with Delta is that Delta prevents mild disease. The J&J vaccine prevents mild disease against Delta by about 50%. So you are 50% protected. And when we look at the Pfizer vaccine, it's about 64% up to 87%. So somewhere in that range. So you still get pretty good protection against mild disease, against Delta. Against Omicron, we're likely to see a somewhat lower level, but in that range in all likelihood.
So to answer the question, what you've just outlined now, Prof, could it be the reason why the northern countries are behaving the way they are? We spoke to the British High Commissioner to South Africa, who is saying that they have a right to be cautious and protect their community. But the question has been raised about, but how do they know that this variant is not in their own country? So that was the question that was asked, is why are people discriminating against South Africa? And the other question was around, could this have been manufactured, to the timing of it? Because as you heard, the elections, there was not so much in terms of non-pharmaceutical interventions that were observed. But then now after the elections, then you have this new variant. What is your response to that?
Okay, so let me deal with the second question, which was around, is it related to the elections? I mean, it's not really feasible to say for sure, but based on the timing, it's unlikely to be principally driven by the elections. And the reason for that is twofold. The first is that we had anticipated, based on the timing of the low transmission gaps we have seen in previous intervals between our waves, we were expecting a 3-month gap. That 3-month gap ends at the end of November. So we were expecting that the next wave would start at the end of November, beginning of December. In fact, at one point, I said, just to give Justice Moseneke some assessment, I said to him, as a point estimate, it's always with caveats, work with 2nd of December. So we were expecting it. The second is that if it was going to be related to the elections, we would have seen the infections rising much more quickly after the 1st of November. We would have seen, within a matter of 14 days, we would have expected to see a rise in cases. We didn't. So it's unlikely. I can't say for sure, because nobody can say for sure. Okay. But people need to blame something. You can blame the elections if that's convenient for you. But from what I've just outlined to you, that's unlikely to be the case. Now, the second issue you raise, for me, is a really critical issue, because it is outrageous that countries are punishing South Africa for being open and transparent and sharing scientific information to help countries control the spread of the virus. We're trying to be helpful. And what they do is they punish South Africa, not just South Africa, it's 7 countries in Southern Africa. Now, let me explain to you why it makes no sense. It's not scientifically based. If you take the Delta variant within a matter of 3 weeks from the first reported case, it was present in 53 countries. As of yesterday, there were over 15 countries that were reporting the cases of Omicron. So you can imagine by Friday this week, we're going to be somewhere in the region of 40, 50 countries reporting this variant. So if you're going to ban travel from South Africa, you have to ban travel from those 50-odd countries, because they also got this variant. Right. And when you get the variant entering, it spreads. The second reason why it's nonsensical is that we already have a good approach to preventing the spread of the virus through travel. It's a 5-pronged strategy, and that is that vaccinated people only travel, a negative test result when you board, you do a symptom check when you board, you wear a mask during the entire flight or sea journey, and then when you arrive at your destination, you have another test. That works. It will prevent most of the infections. Banning doesn't help.
All right, Prof, let's bring up another 3 more questions from our viewers. We've been asking you to engage Professor Karim on what you'd like to know, understand about Omicron, the variant of interest that's been identified. I just want to ask Dr. Salim Abdool Karim how they know if this 4th wave was coming on this month. It's scary. Let's follow all the COVID-19 rules. From Norman Ramapala. Thank you, Norman. Macebo saying, Doctor, I'd like to ask, how do you know the dates and names of these variants? Because it seems like you have got every info about these variants. Macebo, thank you. And the next question, okay, so it's from the same person but different questions. But if we can just spread those who get an opportunity to ask, but the real one saying, is its transmission the same as Delta variant? If not, how is this variant different as well as more dangerous than Delta variant? How do hospitals deal with this variant? I think this question has largely been dealt with in detail. Prof, if you want to add anything more, you're welcome to do so. So the issue of how the WHO goes about naming these variants and the modelling as well. How do you know when, how, etc.?
So in South Africa, we have a whole group of scientists called the Modelling Consortium, and they are led by 2, superb mathematical modelers, Sheetal from UCT and Juliet Pullian from Stellenbosch University. They do these models, but you don't actually need to do any sophisticated modeling. If you just look at our first 3 waves, it's very simple. The waves take about 3 months, and then after each wave that lasts for about 3 months from start to finish, then after that 3 months, we get about 3 months reprieve. We get low transmission for 3 months. It happened between the first and second waves, second and third wave. So we were just anticipating that if that pattern remained, and if that pattern was followed in this for the next wave, because that's how the virus seems to be behaving, that we would predict that 3 months since the end of the last wave is the beginning of December. So that's when we would expect the 4th wave to start. And the 4th wave hasn't started yet officially because it has to meet a certain threshold, but it is likely to hit that threshold in the next day or 2, if it hasn't already with today's data. So it's roughly as we predicted. I have to tell you, we have no black magic or special voice of God that tells us things that doesn't tell you. Nothing of the sort. I have the same information you do. I just use my knowledge to analyze it and to give you some idea of what's likely to happen. If I'm good at what I do, most things that I say are likely to happen will happen. Now, you have to be careful. If you go to a fortune teller and the fortune teller tells you this is going to happen and that's going to happen, and if it really does, that's a good fortune teller. You shouldn't really blame the fortune teller that person's bewitched or has some special knowledge. It's just the good fortune teller. That's all it is. It's nothing more than that.
And the fascinating part about how these variants of interest are then named by the WHO, I've always found it interesting how cyclones and all kinds of, what do you call them, unnatural, godly events are named. So tell us about the process, how those decisions are made, and why Greek names?
Right. So the way in which hurricanes and all of those are named in the US is they just follow the alphabet, and they have a set of names. So Katrina is because it was time for K, and the name they attached to K at that time was Katrina. So that's what caused all that harm in New Orleans, if you remember. With the variants, the decision was made on the basis of advice given by a committee of scientists to the WHO that they should name the variants based on the Greek alphabet. So the Greek alphabet is the basis of the names. Now, they're supposed to just simply take the next letter in the Greek alphabet, but they skipped 2 letters. And as far as I can tell, the main reason they skipped those 2 letters is that those two letters have interpretations that would be confusing. So the last, before Omicron, the last variant was called mu, MU. The next one after that is supposed to be NU, new. But they, I think, might have been concerned that if they called it new, and when future variants come, people will refer to it as new when it's actually old.
Okay,
so
that
they
makes
dropped
sense.
those names, and that's why we ended up with Omicron.
Very fascinating. Prof, let's move on to our next three questions from our viewers. Let's pull them up now. So we're inviting you to engage Professor Karim on the Omicron variant of interest. And if you want to ask him something, please go ahead. John Krobler writing in saying, how can Karim say the fourth wave will commence on the 2nd of December and last 75 days? And that is possible that there's a new variant if he, among others, do not know, control the spread and or the virus is man-made. John Krobler, I'm not quite sure what this means. I'm not sure if you understand, Prof, but you can respond to that if you understand. And let's move on to the next one. Sian Da saying, would you agree that there's something strange about these COVID-19 vaccines? They're not as effective as they were first thought to be. How can you convince someone who has survived the Alpha, the Beta, the Gamma, and the Delta variants without vaccination to be vaccinated? Sian Da, I think that's a fair question, an interesting one, Prof, because there is a lot of vaccine hesitancy, and especially now, I was wondering when you're talking about the virility of this variant of interest, and there are people who are vaccinated. So while there may be compassion fatigue in the hospitals for people who aren't vaccinated, but if I'm not vaccinated and I see somebody who's vaccinated, why would I go and do that? Why would I go and vaccinate?
Yeah, sure. So let me deal with the first question very quickly. I've already dealt with it, but just to reiterate, I don't create these things. No human is creating these variants. They are generated through the course of infection. All viruses mutate, and any half-decent scientist who understands how viruses spread can do some basic predictions about what's likely to happen. So it's just that scientists are good at what they do, and they give you estimates, and if it comes true, be thankful. It means you're getting good advice, and we are helping you understand this virus. It's nothing conspiratorial at all. The issue that you're raising, second question, is, what if you've just been protected and you've never acquired any of these variants? The answer to that is that stochastically, in other words, based purely on a statistical measure, there will be a substantial part of the population that will just not get infected. I mean, I myself have been in the midst of some of the most heavily infected areas. I mean, I went and did the original investigation into St. Augustine's Hospital's outbreak. So I was in the midst of all of the COVID. I've never become naturally infected. And it's because I'm careful. And I think if you're careful, you can protect yourself. But
what do you define as careful? And I think this question was asked earlier on about how do we protect our country. So we've got non-pharmaceutical interventions. So you say you're careful, but one person's careful is not the next person's careful. So how would you say would be the best careful?
Yeah. I mean, when I went to Woolworths yesterday, and people were just not maintaining their social distancing. So I told them, I said, can you see the little circles on the ground? Can you stay with that circle, please? Don't come close to me, right? Because I don't want you to put me at risk. So, and if I see somebody not wearing a mask, I mean, when I take my morning walk, I spend half my time telling people, put your mask on, because you need to protect yourself and you need to protect me. So I will wear my mask. And so if you are careful, you reduce your risk. These public health measures, social distancing, mask wearing, ventilation, they all work. They protect you. The trouble is that a lot of people just don't follow it. And even if a few people don't follow it, they put everyone else at risk. So in my view, that's important. The problem is that that's still playing Russian roulette. It's still putting you at risk. Why not take something that has a much better level of protection? And that's the vaccines. Now, the vaccines are really good in terms of preventing severe infection and hospitalization. Doesn't matter which vaccine you're talking about, doesn't matter which variant you're talking about, all these vaccines do pretty well. I mean, most of them are in the 90+ range in terms of efficacy in preventing hospitalization and severe infection.
Okay.
So I don't want to be in hospital, I'll take a vaccine. You should too.
So before, just as the last question, Prof, you spoke about antibody activity earlier on with regards to vaccines and inducing of T-cell response, especially against a range of a diverse set of epitopes. Just explain that to us and how important that is in terms of prevention of a severe COVID-19 amongst the different vaccines.
Sure. The way in which T cells identify the virus is somewhat different from the way antibodies, identify the virus. Antibodies identify small segments, and even if there's a minor change in that segment of the virus, in that part of the virus, the antibodies can't recognize it anymore. But we have, when you get vaccinated, you get many different antibodies. So some are not effective anymore, but others remain effective. So that's what I talked about when you get partial immunity. Some antibodies won't work, but others will. T cells, on the other hand, they recognize larger segments of the virus. So even if there's small changes in the virus, doesn't bother them. They still recognize it as a virus and they'll go and kill it. So in that sense, we have much more secure protection from our T cells across the different variants. And that's why they work so well. Doesn't matter what the variant is.
Prof, always a pleasure. Thank you so much for your time, for your insights, clarifying some things for us. Professor Salim Abdool Karim.